Total knee philosophy is changing. We know this. Not everybody is in neutral mechanical alignment. We need to start understanding these concepts. And I don't think the language that we use is actually applicable to computer navigation and robotics. This is the one study now that we have that shows that using the same implant, robot versus not robot, is showing better outcomes with the robotic techniques. That's statistically significant. This is from the Australian registry. So there's something here, whether it's alignment, balance, or just understanding, reproducibility of how we're doing the case. Something is helping. Now, CPAC classification was invented. We know that this has been helpful in understanding that different knees are different types of knees, but I don't know how to use this, right? Who can do 87 plus 96 in their head? Raise your hand when you have an answer. Really? I think it's 186, right? I don't know. Is that 6 degrees of Varus or valgus? Still, no idea, right? So and does any of the robotic systems, Seth, can you put in 86 or 96 to the Mako?
No.
Can you, Peter, 87? What does that even mean, right? So this is not useful surgically for me. Now, Jan got into this a little bit, looking at LDFA, MPTA, and this arithmetic hip knee ankle axis. And we're going to simplify this further. Like this knee, we all say that this knee is 14 degrees of Varus. Right? It's 14 degrees of Varus if you measure hip, ankle, or hip, knee to the ankle. All right, what's that actually mean? To me, this knee is the femur's in 0 degrees of Varus, and the tibia is in 3 degrees of Varus. So for me, this knee is actually in 3 degrees of Varus, and the rest, like we talked about, is joint line coming from inside the joint line. It kind of doesn't matter, right, unless we're looking at weird soft tissue defects. So for me, this is a 3-degree Varus knee, and if you're a kinematic alignment surgeon, you're not reproducing 14 degrees of Varus here. You're reproducing 3 degrees of Varus.